Hello and welcome everyone. Thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you have called in via phone only, you can use *9 or *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet that you're from prior to asking your question, and include it in your name so that we can see it in the chat as well. Thank you, and with that, I'll turn over to County Manager Mike Callagy.
Okay, thank you, Denise, and welcome everyone to the Friday edition here so we can update you on our statistics that we normally update you on. So Thursday, we were at 453 confirmed cases. Today, we're at 486, and sorry to report, we had 3 more deaths in that 24-hour period. So we've got 13 confirmed deaths at this point. I would also encourage a lot of you to go to, who are interested in the website, to go here to get updated information. We try to break it down statistically as to age and the different categories. Also love to hear feedback. If there's something that you feel we're missing here, please let us know. We'll try to add it if it's not too onerous and something that's readily available to us. A lot of folks ask us why we're not putting the cities up where folks are diagnosed or where they live and who have been diagnosed. And the real answer to that is, and I had a long conversation with the health official last night about this, and it makes a lot of sense, is that the message that we want to get out there for everyone is to act as if everyone they're talking with, everyone they come in contact with, everyone who used that shopping cart before them was infected with the virus. We know that, of these folks here, we've got 486, but it could be 10 to 20 times that amount, and they could be virtually everywhere in this county. So everyone should use those precautions and make sure that they stay their distance, wear their mask, like I have here. This is a cover. This cover here that we have that is just simply homemade, that I just took off right before this, to when they go out in public. And it's really, these homemade face coverings are really to protect other people, not yourself. So they're protecting the ones that you're talking to, and if somebody you're talking to has one on, you're gonna be protected also. So that's the idea of it. But really, the point of this is that everyone should consider that everyone they're talking to is infected and take the necessary precautions: social distancing, stay sheltered, use wipes if you're shopping, use hand sanitizer before you get in the car, wipe things down when you get home, and use every precaution necessary. And that is a way that we bend that curve of folks who are going to get this and become ill or die from it. Yeah, today we only had 53 people signed up for the Verily drive-through. Again, they have the capacity for 250. So this is something that we're asking our folks here at Health to work with the state on. Again, this is a state-run operation. It's not a county-run operation. So if we're not getting the volume through there, to loosen the standards for what it requires, what is required to get a test. Obviously we love on-demand testing with anyone with exposure, or anyone thinks they're exposed, or if had a family member exposed. We'd love to get more people through, and we'd love to, hit that 250 every single day, and then get the turnaround going in the same manner on the other end for the test results. So we'll continue to work with the state on that, and Verily, and we just want to thank again Verily for being out there and doing this, but we'd love to see them utilized and not sitting there all day waiting for folks to come through. In regard to Seton, yesterday we released the following to Seton: 1,200 safety goggles, 10,050 regular N95 masks, 5,550 small N95 masks, and 300 N95 differential masks. So we continue to be challenged, and really that's our main focus right now, is finding PPEs somewhere in this world. It is, excuse me, not easy. We have literally come across folks, many who are fraudulent, trying to scam those looking for PPEs. We found many that want cash before they deliver it. We went others who want to send a cashier's check or a money order before they deliver the items. So we're using all the necessary precautions in purchasing this. We do have about $12 million in orders out there right now from various vendors, and the lag time on that, lead time on that is between 2 and 6 weeks on some of these items. But we're in real demand of face shields and surgical gowns and surgical masks. We put in large orders for that, alcohol pads and things of those nature. We have a lot of requests out there, and we continue to find more. We believe that if we fulfilled this order of $12 million, it would be merely a third of what we really need. So we're prepared to spend between 12 and $40 million trying to get enough supplies to last the next 90 days. So that is something we've got the majority of our folks working on now here in giving those supplies to Seton. It did impact the county's emergency PPE stockpile, and we'll continue to try to replenish that as other things come in. And we've got a lot of great donations, and we certainly appreciate that. And I'll try to address some of the questions that came up in regard to that. One of the questions was, do you believe the Seton Medical Center is prepared for a surge of patients? The state is leasing 177 beds, which is certainly a great asset to San Mateo County. Anytime you add beds to the inventory of San Mateo County, that is terrific. And we know that there's a surge. If there's a surge, all hospitals will be pushed to their limits. So it's the time now to prepare for that, and we believe that Seton is doing that. But we've made preparations also for that overflow through the hotel space that we've picked up and staffed, and certainly the event center, the medical units that we created there with the 250 beds. But the hardest part of any of this is staffing them. So that's why we're so glad to hear that the governor requested, I think, 50,000 people, and he's received 70,000 applications for those who are medical students or nursing students or those who are retired who are willing to help out. And we would certainly need that in this county, a large number of personnel in this county, if we were to staff all these beds. And it's the same thing that Seton's going to need. So it's one thing to move beds in there. It's another thing to get personnel in there to staff those beds. And we applaud the governor's efforts here, and we think he's right on with trying to get as many beds as possible. And we hope to be over prepared. We hope to never use these beds, but as I said before, if the surge hits, you will not have enough time to put these beds in place. So we'd much rather over prepare and be ready for anything that comes our way. Many nurses at Seton say, another question that came up, many nurses at Seton say that they're under-equipped with proper PPE gear, and they haven't gotten any relief from the state. Is the county asking the state to make sure the nurses are better prepared? That was a question. Listen, the state is being pulled in many, many different directions also. Everyone is in need of PPEs, and that is the struggle. I mean, the military is trying and every state in the country is trying to secure PPEs from around the world, and this is a worldwide epidemic. So we're all in competition with each other, and it is difficult. I'm sure if the state had it, they'd give it to them. The state, says that they will replenish the things that we are giving Seton, but Seton is also a private hospital. I mean, certainly the state has leased floors there, but Verity is the owner, and hopefully they're trying to secure equipment for their staff also. Again, I just want to reiterate that we did get items up there to them to get them through this period of time. And since Seton was bailed out last month by the state for the purposes of treating COVID-19 patients, how do you envision the future of the hospital beyond the pandemic? Well, we see this as a regional asset, and certainly that's why the board decided several weeks ago to put money into whoever bought it for seismic updating or for whatever their needs would be. So, you know, we think that this will serve the northern county well. We understand that there's a group, HMC, who's you know, looking to buy this hospital and is in bankruptcy court doing that now, and we wish them nothing but success. We hope they're very, very successful there, and the more successful they are, the better served the community of San Mateo County will be, in particular those residents in the northern part of the county who utilize the services there at Seton. So we hope that they are very, very successful in their endeavors here. Also, I just want to let everybody know that FEMA reimbursement, we did get confirmation, and we were one of the first in probably the state to ask for reimbursement. So Cal OES today has indicated that our first request has been moved to FEMA, and that was for 50% of the first 45 days, and our ask is for reimbursement is $10 million. Child care, we've established a collaborative task force to lead the design, implementation, and communication efforts for establishing emergency child care for essential workers in San Mateo County. The task force is led by 4 Cs at San Mateo County, first 5 at San Mateo County, and the San Mateo County of Office and Education, the Child Care Partnership Council, the Community Equity Collaborative, and the Silicon Valley Community Foundation. So we think this is essential. If we're asking folks to come in and be on the front lines, we want to make sure, to the extent that they have kids that they're leaving, that those kids are well cared for, and that there's a place for them to bring them so they don't have to worry about them. So just look and see if there's anything else that, yeah, let me talk about 2 other quick items. One is that, you know, one of the requests that came up on the call is how is ambulance service impacted in the county with this disease. And so I looked into that. Calls for service are down 16%. And that makes a lot of sense in that, you know, cars, there's not that many cars on the road, so you're not having the accidents. There's not the kids in school that may fall off the monkey bars, or people getting hurt on the fields that would typically, they would typically respond to. So that is down 16%. They've got a high ratio of their force up and running, and all of them are healthy, and that's good to hear. We want them to stay healthy. We want all our first responders and those in the health field to stay healthy. So another area that I just wanted to update you on is the small business grants. We will hopefully start rolling those out, and this was the money that that the board allocated to small businesses. And Sam Cita has done a wonderful job taking the lead on this. We expect a disbursement plan to come to the board next Tuesday, and that Sam Cita will work on a plan and an application to disperse that money to the small businesses who are in desperate need of money to survive. And we'll also utilize certainly the small business grants from the federal government that are out there and try to help walk them through that process also. With that, Michelle, I think you have a couple more questions that will come in.
I do. Listen to my lovely voice. All right. Santa Clara has a hospital and testing dashboard with total number of tests, along with positive and negative results, positive percentage rates, along with hospital data, beds, ICU beds, surge and ventilators, and total patients. Any plans to do this here in the county?
Well, we're still working on modeling for surge, and that's taken some time. I mean, I think that Santa Clara has higher numbers per capita. You know, we're probably about the same, really. And if you look at the numbers, they're probably 2.5 times our size. And if you extrapolate that out, those numbers are I think pretty close or somewhere in the ballpark. We continue to look at ways to better inform the public, and we want to do so in a meaningful way with the limited resources we have. And we want our health people working on health-related issues. There's a lot of things we could put on there that may be nice to know, but not really important to know and not really meaningful. So we continue to evaluate that, and we'll update that as we can. And we get more numbers in, it gets easier to do that.
Who should residents contact if they have concerns about a testing facility near them, and what precautions are in place for residents near those facilities?
Well, I mean, it's the universal precautions that we've been taking. I mean, this is not something that we believe impacts neighborhoods or anything like that. There's precautions taken at the site, like the drive-through site. We've been there. There's strict precautions in place where folks roll through with their windows up, and when they get to a certain point, the windows come down, and those people who are fully protected are taking the sample. So I don't think there's anything for along these sites. I don't think there's anything for folks to worry about. I go back to, you've got to react to this now. Like everyone you come in contact has it, and that shopping cart that you're touching, you've got to believe that whoever touched that before you had COVID-19, and you should take the necessary precautions in washing your hands and keeping distance from people and wearing that face cover that we talked about.
Has there been consideration into what happens if workers are allowed to return to jobs, but schools remain closed? How will children receive daycare?
Yeah, I mean, that's a question that came up the other day also, and it's something that certainly, as we roll out and restart society, that we'll have to take those things into consideration, and I think that the health officers will take that into consideration. I don't know what the exact plan is yet. I can tell you that we'll be working on that. We have worked on segments of that. How do you restart society after being completely closed? And how do you do it in a precautionary way where you get vital services back up, but maybe not all services, and you do a slow rollout so people can start getting back into some of the routines that they're used to and going to some of the places that they're used to without forming those large crowds again. So I think all that needs to be evaluated. It's being evaluated as we speak, and we'll continue to look at those type of things.
There's movement from the governor to ease some construction restrictions. Has there been communication to the county from the state to make changes and allow some more construction than what is currently allowed in a limited way?
No, to the extent that ours are more restrictive, we believe that, and we've got Amy, our legal counsel here, that we feel that we can impose those restrictions. Our health officers, and maybe we're certainly harder hit in the state. Maybe one size doesn't fit all. We get that, and certainly that other counties and areas can do what they want. But we feel that based on what we're seeing here, that this is the best approach. That housing is important and construction is important, but it's not more important than the health and safety of people. So we've narrowly focused and tailored the exceptions there, and I think that we're going to stick with that. And Amy, I don't know if you have anything to add to that.
I really don't have anything to add. It's a decision that's made based on what's in front of us and what the health officer's concerns are.
Great.
Many stores in some cities are moving to eliminating the option to bring your own shopping bag. Has there been some consideration of a countywide edict to make sure that the policy is the same and eliminate confusion?
There has not been that I know. We'll take a look into that and see if there's any more information on it.
What are the circumstances that need to be met to ease the shelter-at-home restrictions? Is it positive case flattening? And what if the peak never comes?
Boy, if the peak never comes, wouldn't that be terrific, right? And that certainly would be wonderful. What they're doing though is using modeling, and like I mentioned the other day that we're developing an MOU with Stanford. We have the epidemiologists who do a great job, but this is a specialty, and that needs those folks working on it. And we'll be able to tell as time goes on, and as long as we don't hit that peak, time is our friend. We get better prepared, more medical breakthroughs come out. We do a slower roll where we don't need as many people in the hospital at the same time. All those are good things. So We hope that never comes, but at some point in time, we will know where we're at based on the modeling. And this really is a science that can be developed and relied upon, and and then decisions will be made as to when to loosen these restrictions.
All right, and last one from my list. Is there any indication as to what percentage we are at total in ability to keeping patients in hospital beds and not new temporary facilities?
And Peter, maybe you haven't.
Again, it goes back to the modeling, our ability to prepare.
Yeah.
And to what Mike was saying earlier, we are trying to create time for our hospitals to get ramped up. And thankfully, the behavioral health officers got ahead of this and put the shelter in place program. So that will help give us more time to get ready for our surge.
Great, thank you. Is there any questions? I got about 2 minutes before I got to jump on another call.
Yes. Would you be able to provide how many hospitals and ICU beds exist in San Mateo County, how many are empty, and how many are filled with COVID-19 patients?
I don't know if we could probably get to that. I think we have 99 ICU beds, but that varies. It could be down to 66. It's all really to deal. It really comes down to staffing, what the staffing levels are at. So I think we probably have a capacity for 99. The other day was down to 66 based on staffing. So if we do have a surge, that can somewhat fluctuate, and then we can certainly try to increase that if necessary.
Are fraudulent vendors reaching out to the county, and are they just for masks or also for hand sanitizer and other products?
It's for everything, all the way across the board. Yes, we're getting messages from people that rely on them. We certainly go through the procurement and the vetting process before we enter into any contract. And a real indicator for us is people want large amount of cash up front for large purchases and try to push you for large purchases. And we just can't track a lot of these countries down that are foreign countries or foreign businesses in foreign countries.
Is the county filing complaints or charges against those who are not legitimate suppliers?
No, I mean these are from across the world receiving. We don't have time to do that. We'd rather vet it and move on.
County Health reported earlier this week that there are 8 congregate care facilities in the county where 1 or more residents have tested positive for COVID-19. Which facilities are these, and what steps are being taken to keep other residents from getting infected?
Peter, I don't know what you want to say about that.
Yeah, we've taken extraordinary precautions to make sure that those sites are not easily accessible and only the appropriate personnel are coming in and out of those facilities.
And let's just, for everyone to remember, these are state, regulated facilities, not necessarily the county, but we work in coordination, and it's really the state's responsibility to regulate those.
Those are all the chat questions. I don't see any raised hands, so take a final moment, and if not.
Great, thank you very much, everyone, for your questions and for being here, and I hope you all have a great and safe weekend. Thank you.